Today we're dealing with a story that cuts to the bone of what it really means to be South African in 2025. The government has issued a statement after reports that certain groups and communities have blocked foreign nationals from accessing healthcare services at public hospitals and clinics. Let's watch.
Which government? Which government? Which government?
My guy, let me tell you something. Shh. Keep quiet. We don't have time to reason with foreigners. Leave, my guy. Leave.
It's not a story.
No. Leave. Leave. We don't reason with foreigners. We don't want the reason.
You ran away from your problems. You came here.
You go
about the government. You have your own government. Go vote there.
Begging like
If you know that you are not a South African citizen, may you please stand up and leave our hospital. Thank you very much. Thank you, gentlemen. Thank you. If you are not a South African citizen, please leave our hospital. How are you, my good doctor? Anyone who is not a South African citizen, just because of their this side, please stabilize them. After they've been stabilized, you can discharge them. You are a refugee. Yes. You came here legally. They could have directed you to the camp. So they could have, whoever who allowed you to be a refugee here, not unless you bought your document. So whoever who allowed you here.
The problem is if I'm not South Africa doesn't even have a single doesn't have a refugee camp. I'm not in the camp.
Okay.
Whose problem
is
if I'm not?
Let me answer you then.
Who's the camp so I can go to?
Okay.
Which country do you come from?
I'm from Congo.
Congo.
You're from Congo. What is the nearest country to Congo? If you're seeking refuge in South Africa, because according to foreign policy,
you're supposed to go
you
to
must
car.
migrate to them.
You're
So
supposed
you cannot
to go
come
to
to
car.
South Africa, seek refuge in a wrong country,
South Africa's not
and
the
ask
nearest.
us silly questions, ma'am.
No, the government.
Which government?
The government.
Which government? Which government you're
My
talking
guy,
about?
let me tell you something. Shh. Keep quiet. We don't have time to reason with foreigners. Leave, my guy.
Let's go, ma'am.
No.
Let's go, ma'am.
Shush. Leave. Leave.
Let's go.
We don't reason with foreigners. We don't want the reason.
You ran away from your problems. You came here.
When you get well, when you get on that hospital bed, just look at it. Next time when you come, when you want services,
There won't be a next
check
time.
up.
There
When
won't
you
be a
want
next
check up,
time.
you must go to a private clinic or a private hospital. When you get well from our hospital bed, do not come back here. Here, we only allow South Africans only. All hospitals, all public hospitals in KZN, all public clinics in KZN are for South Africans only. Do not ever come back here when you get
In
well.
addition to that, my good doctors, after you release these people, you can write them their scripts, but they're not going to use our pharmacy. They must get their medication from private hospitals or from pharmacies, registered pharmacies.
Now, in other words, ordinary citizens frustrated and angry are turning away migrants at the gates of public health facilities. And now government is stepping in, warning that such actions violate our constitution and undermine human dignity. And finally, we need to unpack this because it's not just about clinics, it's about history, and it's about survival and the burning contradictions of post-apartheid South Africa. Now, according to the government statement issued by the Government Communications and Information Systems, denying anyone healthcare is unconstitutional. Section 27 of our Constitution clearly says everyone has the right to have access to healthcare services. Not South Africans only, not citizens only, everyone. Now that means a Zimbabwean mother, a Malawian father, and a Congolese child, even someone undocumented, if they are within our borders, they have that right. Government added that South Africa has also signed international agreements to protect this access, and the police, along with the public order units, are now being deployed to stop these blockades and to keep clinics open and to make sure no patient is intimidated. And on top of that, they're saying that they're strengthening border management and dealing with illegal immigration and trying to hire more healthcare staff to ease the burden. So that's the official line. But here's where I speak, not just as a journalist, but as a Black South African. Government can quote the Constitution all day long, but the frustration on the ground is real. Our clinics are collapsing, our nurses are exhausted, the system is breaking under the weight of poverty, mismanagement, and corruption. And for many South Africans living in poverty, when they stand in those long queues and can't be helped, when medicine runs out, when they watch their mothers die waiting, They start to feel like outsiders in their own land. And then when they see migrants, many undocumented, right, also lining up for the same services, it becomes easy to direct anger at them. But I say that that anger may be misdirected, but it is real, right? And as a South African, I get it. I've seen the frustration. I've seen the elderly faint in a line at an overcrowded clinic. I've seen mothers turn away with sick babies because there are no doctors on call. And I've heard the whispers, right, that these services are full because of foreigners. Now, let's be honest, right? Migration does put pressure on public services. That's the truth. We can't deny it. Government knows it, and that's why they keep talking about border management. But here's the deeper truth. The collapse of our healthcare system did not start with migrants. It started with apartheid underfunding Black areas. It continued with ANC mismanagement, with cadre deployment, and looting of health budgets. It is worsened by corruption in every single province. So yes, migrants are part of the equation, but they're not the root cause. And here's the contradiction, right? The same government that tells us don't block foreigners from healthcare is also the government that has failed for 30 years to fix the healthcare system for its own citizens. So when they tell us that respect human dignity, we ask, where was the dignity when life, many patients were left to die? Where's the dignity when our ambulances don't arrive? Where's the dignity when clinics run out of ARVs? That's the real crisis here. And let's zoom out, right? Because across the world, migration creates tension. In Europe, migrants drown in the Mediterranean. In America, children are locked in cages at the border. In South Africa, poor Black migrants live in informal settlements, undocumented and hustling to survive. And in every case, the poorest locals, those already suffering, feel the pressure more. And this is why we see violent protests. This is why we see xenophobia flare up. And this is why we see communities blocking access. It is not simply hate, it is frustration that is boiling over. But when that frustration targets the vulnerable instead of the powerful, it becomes dangerous. Now, family, here's my position. I believe in African solidarity. I believe we must remember that apartheid was crushed with the help from Zambia, from Tanzania, from Mozambique, from Nigeria, from the very migrants we want to exclude today. But I also believe that South Africans have the right to demand a functioning healthcare system that prioritizes citizens. We are not wrong to feel frustrated. We are not wrong to want order at the borders. We are not wrong to say government must put us first. I think the problem is that too often, instead of holding government accountable, we turn to each other. Black South Africans against Black Zimbabweans, Zulu against Shona, Bedi against Malawian. And meanwhile, the people who actually collapse the system, the corrupt politicians, the tenderpreneurs, the looters, walk free every single day. And we end up fighting each other while they're laughing in parliament. And spiritually, family, this is dangerous because colonialism thrived on dividing Africans, on setting tribe against tribe, border against border, language against language. So we must be very careful not to repeat that pattern. Because while we're fighting over clinic queues, the land is still stolen. The mines are still foreign owned, and the banks are still in the white hands. And that is the real enemy, not the Zimbabwean woman sitting or standing next to you in a line at Baragwanath Hospital. So where do we go from here? I say that government must stop issuing statements and start delivering services and stop telling poor people not to protest and start fixing the system. Stop hiding behind constitution and start making that constitution real. Communities must stop taking the law in their own hands, but we must also stop being silent at corruption, at looting and mismanagement. And we as Africans must remember that the dream of liberation was not a South Africa for South Africans only. It was free Africa united with the dignity for all Black people. But that dream will die if our leaders continue to fail us. Now, I'm Naledi Mfoloe, and this is ANC, where our truth is global, powerful, and unapologetically Black. Let's continue the conversation in the comment section. I'd really like to hear your thoughts on this. And while you're at it, don't forget to give this video a thumbs up. Till we meet again, it is bye-bye for now.